afternoon, ladies and gentlemen, respected deans, students, as well as all the friends and families joining us on the live stream today from around the world. I welcome you all to the White Coat Ceremony 2021. My name is Nuha Pirali, and I have by my side here my colleague Filip Nazarevich. We're both second-year medical students from the 4MD program. Today we have the honor to be your Masters of Ceremony. We would first like to warmly welcome our distinguished school authorities. Please welcome Professor Katarzyna Ziemniska, Director of Center for Medical Education in English. Associate Professor Agnieszka Malinska, Vice Director of Center for Medical Education in English and Associate Dean for Basic Sciences of MD Program. Associate Professor Justina Opido-Szymacek, Vice Director of Center for Medical Education in English and Associate Dean for Dentistry Program. Professor Jan Mazela, Associate Dean for International Cooperation. Associate Professor Alicia Kalinowska, Associate Dean for Elective Clinical Rotations. And finally, Professor Grzegorz Dworawski, Director of the International Admissions and Promotion Office. I'd like to welcome Filip to say a few words.
Thank you, Nuha. Welcome again, everyone. Welcome again, students. Under normal circumstances, I would probably give advice to those who just completed their first year, but seeing as I'm a second year speaking to a bunch of third years, I don't think that's going to be necessary, seeing how far you guys made it. However, as I look into the crowd, I do see many familiar faces. Some of you I know very well, some of you I've only met once or twice, and some of you I've unfortunately yet to meet, but regardless of all that, I would just like to say how proud we are of all of you for making it this far, and I personally can't wait to be in your shoes next year. And to those who have taken or plan to take, for example, the STEP exam or any other licensing exam for that matter, we wish you all the best. And you should know that you'll make your family, your friends in this university extremely proud. And as a wise man once said, keep your eyes on the prize. Now, I would like to take this opportunity to kindly invite Professor Jan Mazela to deliver a few words.
Dear students, guests, faculty members, the White Coat Ceremony is a rite of passage for medical students and was created by the Arnold P. Gold Foundation not long time ago in 1993. During the ceremony, a white coat is placed on each student's shoulders, and often the Hippocratic oath is recited, signifying their entrance into the medical profession. It is a symbol of the shift from the preclinical world to clinical one. I wanted to share with you some of the thoughts I have regarding this attribute, the white coat. My own experience with the white coat, the first flashback. When I was asked by the director of the Center for Medical Education in English, Professor Katarzyna Ziemniska, my boss, if I would be willing to have a few words for you, I lightly agreed. But later the thought came to me, I never wore a white coat. And isn't it ironic that I was asked to talk to you about this symbol that day, this attribute of being a doctor? I have stopped wearing white coat during my fellowship in neonatology in the United States shortly I graduated medical school. I have had rotations in general pediatrics in the pediatric clinic of the Georgetown University in Bethesda, run by Dr. Anna Erdmann. And I have to say a few words about Dr. Erdmann. She was one of my first role models, my tutor, and an exceptional person. She was a granddaughter of the famous Polish writer and journalist Melchior Wańkowicz. And she was the one who stopped me from wearing the white coat. She took me to her office after my first day at her clinic and told me, Jan, we are not wearing white coats. We just wear casual clothes or scrubs. Well, the scrubs they were wearing, they were not the scrubs, but rather pajamas with teddy bears on them, balloons, toys, etc. So I kind of was not very happy because I thought, okay, if I'm wearing pajama, how anybody would know that I'm a doctor? So she definitely saw my hesitation doubtfully present on my face and replied, Jan, our patients are afraid of white coat. Whenever they see white coat, they start to cry because usually there is some pain related to their visit in the office, either blood sampling or vaccination. So we try to release their hesitation and stress and let's not to wear white coat. Later, during the NICU and follow-up clinic rotations where I had to shift from one to another the same day, I have learned that tie is also not an option to wear. Kids love to catch hanging things over their heads. So one kid touched, another kid touched, and my tie became a fantastic carrier for the bugs. So my tie was cut down to bow tie by the head nurse. So those of you who want to do pediatrics, keep in mind that you will need to accommodate your clothing to your patients. But let's come back to my white coat story. Since that time, I was not wearing white coat. I was wearing white coat only in my heart to remind me that I am a doctor. A little bit of history, the second flashback. It may surprise you to learn that historically and up through the late 19th century, doctors actually didn't wear white at all. In fact, they only wore black. The black garments of the doctors of the past not only signify their somber, serious presence, that, let's face it, it was pretty much associated with death most of the time. But they also served the pretty practical function of disguising dirty garments and all of the messy stains of the profession. Out with that black look of death and in with the clean, sterile look, hospitals made this switch to equipping their beds with fresh new white sheets. Nurses topped their heads with the cap, nice white caps. Doctors were wearing fresh, new, fancy white coats meant to restore the public trust in them and their new hand-washing skills. Sure, the black coat may have been a little more practical in terms of hiding stains or ushering a patient to the other side, but the white coat became an overreaching symbol of the new face of medicine. The shift happened relatively quickly, as two famous paintings by Thomas Eakins famously depict, one portraying an operating theater of doctors all dressed in dark coats in 1875, called the Gross Clinic. This painting you can see in the Department of Anatomy, the copy of it, of course. And the second, painted in 1889, so a few years later, called the Agnew Clinic, with doctors all wearing white coats. No one is 100% sure where the first white coat came into the picture or who exactly designed it, but it is clear that the white coat became synonymous with portraying the doctor as a clean, safe source of authority in the new and improved medical field, and that image has never really left. And thus, the iconic doctor's white coat was born. Is the white coat doing anything good or bad? Well, I told you a minute ago why in pediatrics world we don't use that much of a white coat. But you probably also have heard about the white coat hypertension. Nevertheless, many patients still find comfort in the symbol of the white coat for medical professionals, so it remains a central figure in patient-centered care. In fact, doctors, nurses, nurse practitioners, and physician assistants can have the best of both worlds with practical, comfortable scrubs that can function in the role of hands-on patient care and professional lab coats that have a modern fit and quality material. The meaning, the third flashback. I'm looking at you today. You all have smiles behind the face masks. You seem happy, proud. You are doctors, almost. Today you are empowered to wear the iconic symbol of medical profession. But I want you to wear this white coat not only on your shoulders. I want you to wear it in your heart. To be not just a doctor, but to be a good doctor. It is known that patients respect the white coat. They look at the white coat with hope. They hope for cure. They were admitted to hospital because they had to, because they didn't feel well, because they felt pain, fatigue, or maybe because they have serious illness already named cancer. The hospital or clinic environment is not friendly for them. They feel very insecure, lost, sometimes frustrated. You, the good doctor, is not only the professional like handyman who will give them diagnosis, prescribe solution, fix the tubing, repair the leakage. You are a human being and a doctor. Talk to them, hold their hands, joke with them. Then you will see a smile on their face, which may appear regardless of the tough verdict you passed on them after biopsy test results came back from the pathology lab. The secret of being a good doctor is to find balance between professionalism and humanism. Let the white coat carried in your heart helps you to find this balance throughout your professional life. Let just not be an attribute. Let it be a reminder. Be a good doctor. I wish you all today. Thank you.
Thank you so much, Professor Mazzella, for delivering those beautiful words of encouragement. And now I'd like to invite Dr. Amira Shadi, a recent graduate of PUMS with the class of 2021, to deliver a speech.
Good afternoon, ladies and gentlemen, distinguished deans, members of the faculty, family and friends watching us today, and most importantly, the students. It's my honor to speak to you today on this special occasion of your white coat ceremony, a tradition that is a symbol of embarking on this great journey. The pandemic took away the opportunity for you to have this ceremony after your first year, so I'm not going to congratulate you on getting into medicine because it's been a while now. However, you should be proud of yourselves because you've made it this far, so you fully deserve this celebration of your achievements so far, and may it be a motivation for the next few years ahead. Because medicine is not just a profession, it's a lifestyle. You've made a choice to commit yourself to a lifetime of hard work, dedication, and sacrifices. You will be challenged during your studies, when you graduate, and throughout your whole medical career, by your peers, your professors, and your patients. That's why you need to remember why you started, why you chose this career path. I remember my white coat ceremony on June 2nd, 2016. Funny enough, on June 2nd, 2021, I graduated and became a doctor. I remember getting on the stage and having my white coat put on. I remember the emotions and the thoughts going through my head. It felt like a very special moment. It is indeed a big step in your journey. Wearing a white coat and a title comes with a great responsibility. Never forget about it. Now at work, I have these moments when I think to myself, wow, I made it. And just a few years ago, I was in your place. The time goes by quickly. Believe it that you can make it as well. Wherever the life takes you, wear your white coat with pride, but at the same time with compassion and humility. Stay humble. Being a healthcare provider is a privilege. To be your patient's caregiver, to be the only person standing by their deathbed, the last smile they see, the last conversation they have, the person they rely on during their long treatment process. Don't you ever forget that for the patients, you're the symbol of care, hope, and trust. Today you're going to take an oath, the same oath I took 5 years ago during my white coat ceremony, and the same oath I took 4 months ago at my graduation, and the same oath healthcare providers take all around the world, and is a symbol of ethics. I hope you do it with awareness and you follow it in your medical career. If you ever doubt yourself, I hope that seeing your patients smile and gratitude will pay off all the hard work that you've had to put in throughout all these years, and that it will make you feel like you picked the right profession. Remember that the knowledge you acquire now, you will use during your whole professional life. So don't study just to pass your exams. Study to understand and become a better healthcare provider for your future patients. Medical studies are not only about spending time with books. It's the time for your personal development. It's the time and community that teaches you leadership, commitment, responsibility, and perseverance. So stay kind to one another, help each other out. It's a teamwork. Now, during medical school, and later on. The last thing I want to share with you is a piece of advice, a text, that has been with me since my second year. I've had my Elements of Professionalism course taught by Professor Mazella, who made it possible for us to have a few lectures with Dr. Truman Merritt from the US. Dr. Merritt gave us some assignments that we needed to send back to him. We needed to write essays on some important topics in medicine, like patient's autonomy, kindness, professionalism. Dr. Merritt shared with me the following text that I want to share with you now, and that has been one of the greatest influences throughout my medical school, and I know I will go back to it throughout my whole life. Let me introduce myself. I am your patient. I am the king's daughter. I am your patient. I live under a bridge. I am your patient. I am governor of the state. I am your patient. I fry hamburgers at McDonald's. I am 83 years old next week. I am 17, going on 35. I am Black. I am Chinese. I am Dutch. I am a Muslim. I'm a Buddhist. I'm a Christian. I am a woman, a man, gay, straight, rich, poor. I am fat. I am tall. I am skinny. I am short. I shop at Nordstrom. I shop at the House of Thrift. I drive a Porsche. I ride a bus. I'm powerful. I'm not. I'm funny. I'm dull as bones. I am rebellious. I am sensible. I am sympathetic. I am negligent. I am dying. I hurt bad. I am expecting my first child. I'm on drugs. I was shot in the abdomen. I was raped. I need my teeth fixed. I need my life fixed. I need you. I need your knowledge. I need your skill. I need your respect. I need your attention. I need my dignity to survive in addition to my body. I need to know your name. I need to know you care. I need to understand what are you talking about. I need information. I need to make decisions. I need you to protect my privacy. I need your smile. I need you not to give up on me when things look discouraging. When I see you, I need to know I'm not just a number. When I see you, I need to know I'm not in this alone. When I see you, I need to know I'm getting first-class care. When I see you, I need to know I'm your most important patient. I am a free being. I do have the power of choice. I may come to your hospital. I may go elsewhere. Are you happy to meet me? Do you want me to stay? I am your patient. Let me introduce myself. I want to leave you with this, and I hope it inspires some reflection. As a member of the medical profession and a recent graduate of PUMS, I want to welcome you to the start of this fulfilling lifelong journey. Congratulations and good luck, future doctors. Thank you.
Thank you so much, Dr. Shadi, for taking the time to join us today. We wish you continued success in your career. And now is the time, folks. Now we will begin with the formal walking of the stage, and we kindly remind you that this year, due to the COVID pandemic, that you'll need to have your white coats already cloaked, masks worn, and be prepared to fist bump our distinguished school authorities. So we will begin with the names of the Advanced MD program. If they would like to go ahead and start assembling to the stage, please. First, we're going to have Robert Ashkar. Shanika Asavaritarong, Tse Yuen Ao, Marun Badr, Shemiram Benjamin, Wei Xin Chang, Liang Yu Chen, Stephanie Dar, Firas Darwich, Dimitra Delim Paltadaki, Diane El Ashkar, Gazwa Farah El Rabah, Denisa Dorjeva, Lucine Hakobian, Su Yao Shu, Hui Chun Shu, Min Li Huang, Marta Kaidas, Dalia Karkar, Jacob Kulaga, Chen Li Lin, Bing Zheng Lin, Rawad Merhi, Jacob Mitchell, Vivikan Narayanan, Omar Tontoji, Solamir Turchin, Lena Vo, Thaddeus Victor, and last but not least, Nicole Wojcik. Congratulations to the 4MD students.
I would now like to welcome the 6MD students on stage, please, starting with Ovia Anadurai, Alima Ayaz, Mariel Beatrice Baru, Matthias Barstad, Ting Wei Chang, Yen Shin Chang, Vicky Shu, Victoria Hilinska, Maria Mode Nawabi Estanagzai, Husnain Hashmi, Shu Shan Xia, Xin Yu Kang, Mary Fasmer Carlson, Nacha Kramul, Peter Kulaga, Hong Chun Lai, Kalmudiman Mohan, Mehek Mitra, Pavitra Mutia, Mithun Pandian, Ine Hasbi Sannes, Sufisha Siravatanakul, Christians Board, and Yi Chen Yang. Congratulations, 670 students.
Congratulations, 6MD. Now I'd like to invite the DDS students to the stage, starting with Louise Hauglandberg, Chung Yuan Chang, Young Chun Chang, Shi Yuan Chen, Zhui Xiang Chen, Min Chia Chen, Sandy Chen, Ya Xin Chen, Yuan Chen, Ingrid Dukefos, Shu Ting Ho, Mei Tsung Chia, Chia Yun Xia, Wan Ling Shu, Mona Jaber, Kine Elizabeth Lorenzen Johansson, Tetiana Koftin, Aya Kraiz, Shi Huan Li, Aryan Movagatian, Lily Post, Jakub Presello, Padnarin Sena, Abdul Qadir Osman bin Awen Said, Yi Chen Wu, Tai Chun Ye, Aaron Zaganjori, and last but not least, Victoria Zayats. Congratulations to the DDS students. Good job, guys. Now that we've finished and wrapped up all the names for the ceremony, I would like to now invite Associate Professor Justina Opido-Szymacek, Vice Director of Center for the Medical Education English and Associate Dean for the Dentistry Program, to the podium, and for the students to stand up together as the professor reads the Hippocratic Oath.
Accepting with respect and gratitude the conferred title of physician and being fully aware of the responsibilities involved with it, I do solemnly swear to fulfill my duties conscientiously, to protect human life and health, to prevent suffering and disease to the best of my knowledge, and to help bring relief to the sick, irrespective of any differences as to their race, religion, nationality, political views, or financial status. Always bearing in mind the patient's welfare and showing them due respect, not to betray their confidence and keep private all knowledge concerning the patients even after their death. to protect the dignity of the medical profession, not to dishonor it, to treat my colleagues with due kindness without questioning patients' confidence towards them, yet at the same time acting impartially and having in mind the welfare of the patients under my care, to widen my professional knowledge and to share with the medical world all that I shall be able to discover, invent, and improve. I do solemnly swear.
Thank you so much, Professor. And to finalize everything, let us welcome again Professor Jan Mazella to close the ceremony. Congratulations, everyone.
Well, dear friends, the ceremony is closed. You're free to go. Before you go and treat your patients, fix their teeth, take the OSCE exam, before you prescribe the drugs, make sure you pass the pharmacology exam, okay? So just don't be too happy, but definitely enjoy today's day. It's a big day for you, so congratulations once again. Thank you.
Everyone, you can have your professional pictures taken outside, so just line up outside the hall, please. Thank you. Have a nice day.